The first injury we're going over is the anterior cruciate ligament sprain. This can be defined as either a complete or partial tear of this ligament. It can happen with contact sports or non-contact sports, but most of the time it's a non-contact injury where the player or athlete is decelerating and internal rotation is happening at the knee. In our book, when he describes the anatomical positions and what's going on, it's pelvic tilt with ipsilateral hip adduction with the valgus force on the knee sharing of the femur, and the fibula is abducting while axial load on the tibial with internal rotation. So that is pretty much the mechanism of the injury and how the body is positioned during this type of injury. So this exercise is the knee inflection extension. It's a mobility exercise meant to increase the range of motion after an ACL sprain. You want to do this exercise up to 10 to 20 times a day. Repeat it 3 times a day until you've regained full range of motion and there's no pain associated with this exercise. This exercise is the static hamstring hold. This is a strengthening exercise. This is what it is. It's a revised resistance to the hamstring, both the middle, the lateral, and the medial, which produces more strength for the muscles surrounding the ACL. The way you want to do this, you want to hold it up for 3 to 4 seconds and then relax. And you want to do this up to 3 to 4 times a day, maybe 10 reps, until you once again no longer feel pain and have full range of motion in that area. This final exercise that we're going over in the ACL sprain and rehabilitation is the forward lunge. The way you want to do this is you want to aim for about, once again, 3 sets a day. You want to do about 10 to 20 repetitions, and you want to go down as far so where you don't feel any pain on the injured joint, and you want to also increase the weight and also the range and flexibility as you are no longer feeling pain and progressing through the injury. The second injury we're going over is glenohumeral dislocation. This is a very common injury in football. It usually happens when somebody's tackling. According to Prentice, the mechanism of injury, the most common one, is the force, abduction, external rotation, and extension that causes the humerus to be pulled out of the glenoid cavity. The most common dislocation is the anterior posterior dislocation. It's where it's being pulled not only forward but down. So the first exercise we're going over in the glenohumeral dislocation is the posterior capsule stretch. This is a mobility stretch, helps with the range of motion, it's going to increase the progression of rehabilitating this injury. Once again, you want to do this like 3 sets a day. You want to do it for about 20 seconds or as long as you can handle. You don't want to cause any pain to this joint, and you want to just progress from there. This second exercise for the glenohumeral dislocation is the scapular elevation strength exercise. This is going to promote strengthening the glenohumeral joint from after it's been dislocated. It's going to help strengthen the muscles around that area. You want to do this 3 sets up to 15 reps a day, and you want to increase your strength. You want to increase the weight and flexibility as much as you can as you progress through this injury. This final exercise for the glenohumeral dislocation is a functional test, and it's called the push into the wall. And pretty much what you're doing is just giving a little bit of a push. You're not trying to hurt them or anything, to allow them to catch themselves as well as push back off and work on their range of motion as well as a strength exercise. You want to do this for 3 sets a day up to 15 times a day. The final injury we're going over is the ankle sprain, the talocrural joint. This is what happens is when this ligament becomes overstretched, or torn. These types of sprains can be graded from a 1 to 3, with 3 being torn and the most serious to a 1 just being strained or stretched of the ligament. common mechanisms of injury for this are plantar flexion or inversion of the ankle as it's coming down. Downward force causes more injury to this, to the ankle joint. The plantar flexion and the inversion causes the anterior talofibular ligament to become sprained. The first exercise that we're going to go over for the ankle sprain is the gastrocnemius stretch, and this is as you can tell, is a stretch exercise, and once again, it's meant for the range of motion and flexibility of the ankle joint. You want to hold this for about 30 seconds, or for as long as permits. And like I said, you don't want to, create pain in the joint. This is purely just to keep the range of motion and not allow the joint to start tightening up. Good. Okay, Riley. The second exercise is a strength building exercise in the ankle sprain, and this is the resisted plantar flexion. And as you see, you want to have the athlete pulling away slowly as you return the position to them. You want to do this up to 10 to 20 reps, 3 sets, and you want to have them hold it as long as they can, up to about like 30 seconds or so. This final exercise in the ankle sprain is a progression from the resisted plantar flexion. As you can see from where she started, she was pointing her toe outward and then goes into the heel-toe walk where she is standing up onto her tippy toes, strengthening the ankle joint. Once again, you want to do this up to 10 to 20 reps, holding it as long as you can at the top, as well as not causing any pain and just gradually, slowly progress in strength and flexibility of the ankle joint.